Sleep is essential for our health, but what happens when the very act of sleeping becomes a health risk? Today, we'll explore how obstructive sleep apnea, or OSA, can cause or aggravate conditions like hyperthyroidism and hypothyroidism, leading to long-term effects on your health. Obstructive sleep apnea is primarily associated with cardiovascular, metabolic, and respiratory issues, but it can also influence endocrine function, including the thyroid gland. While OSA does not directly cause hyperthyroidism or hypothyroidism, it can potentially aggravate or contribute to the development of these thyroid conditions through several mechanisms. Intermittent hypoxia and inflammation. Intermittent hypoxia, OSA, is characterized by repeated episodes of partial or complete upper airway obstruction during sleep, leading to intermittent hypoxia, reduced oxygen levels. Hypoxia triggers systemic inflammation, marked by the release of pro-inflammatory cytokines. Impact on thyroid function. Chronic inflammation has been linked to autoimmune thyroid diseases, such as Graves' disease, which can cause hyperthyroidism, and Hashimoto's thyroiditis, which can cause hypothyroidism. Inflammation from OSA could potentially worsen these autoimmune conditions by exacerbating the immune system's attack on thyroid tissue. Sympathetic nervous system activation. Chronic activation, OSA, leads to frequent arousals from sleep and activates the sympathetic nervous system, resulting in increased levels of stress hormones like cortisol and adrenaline. Impact on hyperthyroidism. The sympathetic nervous system can influence thyroid hormone secretion. Chronic sympathetic activation in OSA may potentially stimulate the thyroid gland, exacerbating conditions like hyperthyroidism, where the thyroid is already overactive. Impact on hypothyroidism. Prolonged stress responses due to sympathetic overactivity might contribute to or worsen hypothyroidism by disrupting the normal regulation of thyroid hormone production. Hormonal disruption. Cortisol and thyroid function. OSA is associated with elevated cortisol levels due to stress and sleep disruption. High cortisol levels can interfere with the conversion of thyroxine T4 to triiodothyronine T3, the active form of thyroid hormone, potentially contributing to or worsening hypothyroidism. Insulin resistance. OSA is linked with insulin resistance, which can influence thyroid function by disrupting hormone metabolism. Insulin resistance is associated with metabolic changes that may impact both hyperthyroidism and hypothyroidism. Impact on autoimmune thyroid conditions. Autoimmune link. OSA-related inflammation and hormonal imbalances can potentially aggravate autoimmune thyroid disorders. In individuals predisposed to autoimmune thyroid diseases, OSA could worsen the course of conditions like Hashimoto's thyroiditis, leading to hypothyroidism, or Graves' disease, leading to hyperthyroidism. While obstructive sleep apnea does not directly cause hyperthyroidism or hypothyroidism, it can aggravate these conditions or contribute to their development. The mechanisms involve intermittent hypoxia, chronic inflammation, sympathetic nervous system activation, and hormonal disruption, all of which can impact thyroid function. Therefore, in individuals with OSA, there may be an increased risk of thyroid dysfunction or worsening of existing thyroid conditions. It is important for healthcare providers to monitor thyroid function in patients with OSA, especially if they exhibit symptoms of thyroid imbalance. The thyroid gland's role. The thyroid gland plays a critical role in regulating your metabolism, energy levels, and even your heart rate by releasing hormones like T3 and T4. However, the disruptions caused by OSA can throw your thyroid into disarray. OSA and hyperthyroidism. Hyperthyroidism occurs when your thyroid produces too much hormone, leading to symptoms like anxiety, rapid heartbeat, and weight loss. Studies suggest that the stress and oxygen deprivation caused by OSA can trigger an overactive thyroid or worsen pre-existing hyperthyroidism. OSA and hypothyroidism. On the other hand, hypothyroidism is when your thyroid doesn't produce enough hormones, leading to fatigue, weight gain, and depression. OSA's constant stress on the body can also lead to or worsen hypothyroidism, further disrupting your health. Long-term effects of OSA on thyroid health. Over time, the relationship between OSA and thyroid disorders can become a vicious cycle. Untreated OSA can lead to worsening thyroid conditions, which in turn can make sleep apnea symptoms more severe. This can increase the risk of serious complications like heart disease, stroke, and metabolic disorders. Recognizing and treating OSA early is crucial, especially if you have thyroid issues. Treatments like CPAP therapy can help keep your airway open during sleep, while thyroid medications can help regulate hormone levels. Combined, these treatments can help prevent the long-term effects of these conditions. Sleep and thyroid health are deeply connected. If you or a loved one suffer from sleep apnea or thyroid disorders, talk to your doctor about how to manage both conditions effectively. Your health depends on it.